So unfortunately, I wasn't able to get to Los Angeles. The international workshop has just finished, but I've been keeping an eye on Twitter, and some interesting things have come through. For example, a group from British Columbia have described tweaking the CAR T cells so that they secrete interleukin-12, and that seems to have a beneficial effect on the tumor microenvironment. Others, for example, from the University of Calgary, they've looked at why some people fail CAR T cells and also BiTE cells by describing mutations of the BCMA extracellular domain. Other things that were interesting, that people looked at responses of myeloma patients to vaccines against COVID. And as we might have expected, they found that a lot of myeloma patients had very poor response, both by antibody response and also by cellular response, especially if they'd been on recent monoclonal therapy or other cellular therapies. As regards looking forward to ASH, obviously, with younger patients, there is a movement, as I said, to treat them more aggressively on front, get minimal residual, hopefully remove any evidence of minimal residual disease, and hopefully the idea would be then, following that one might use cellular therapies more upfront, for example, CAR T cells or BiTE cells, and perhaps ultimately get cure of some of these patients. So it's very promising. And so there's a lot of work on BiTE cells and other monoclonal antibodies and on CAR T cells, and that work's going to continue.